Hello and welcome. I'm Professor Shaibu Orichabello, and in this lecture I want to talk with you about something we all do, often many times a day, yet rarely stop to examine: writing a prescription. Whether you're a medical student writing your very first order, or an experienced physician looking for a quick refresher, my goal over the next half hour is simple: to help you write prescriptions that are complete, unambiguous, and above all safe. So settle in and let's get started. So let me start with why this matters so much. Prescribing is the single most common intervention we make in medicine, and that means even small habits, good or bad, get repeated thousands of times. The World Health Organization estimates that medication errors cost around $42 billion every single year, and through its Medication Without Harm initiative it set a goal of cutting severe, avoidable medication harm in half. Here's the encouraging part, and I want you to hold on to this throughout the lecture. Most prescribing errors are predictable and preventable. It isn't heroics that keep patients safe, it's consistent, careful habits. That's what we're going to build together. So what will you take away today? By the end of this lecture, I want you to be able to do 6 things. First, write a complete, legally sound prescription every single time. Second, use unambiguous drug names, doses, roads and directions. Third, avoid the error-prone abbreviations and dosing pitfalls that trip up even seasoned clinicians. Fourth, apply the core safety checks, allergies, interactions, and medication reconciliation. Fifth, adapt your prescribing for special populations and controlled drugs. And finally, communicate clearly with both pharmacists and patients. Keep these 6 goals in mind now, especially for the students watching. Let me connect this to the classical structure you'll see in textbooks. Traditionally, a prescription has 4 Latin parts. The superscription is the Rx symbol, take thou, along with the date and patient details. The inscription is the medication itself, the drug name, strength and form. The subscription is the instruction to the pharmacist how much to dispense. And the signature or sig is the direction for the patient how to actually take the medicine. Modern prescriptions simply add your identifiers, signature and date on top of these 4. Knowing the anatomy makes the whole thing feel logical rather than memorized. Every prescription answers 2 questions: who is it for? Every prescription answers 2 questions: who is it for and who wrote it. For the patient, I want the full legal name, the date of birth, and for children, the weight, because so much of pediatric dosing depends on it, an address or unique ID, and any known allergies. For the prescriber, that's your name and credentials, your practice address and contact number, your registration or license, including controlled drug authority, where it applies, and a legible signature with the date. These details aren't a bureaucracy, they're what lets a pharmacist verify and, if needed, reach you. The drug name should be written in a way that it is clear and easy to read. The most common method used for writing drug names is the International Non-Proprietary Name (CINN) edition. Using INN ensures that there is no ambiguity in the drug name. For example, the brand name prednisone can be written as MTX, which stands. Here's the formula I want to become second nature. A complete order names the drug, its strength, the form, the dose, the route, the frequency, and the duration. Look at the example: amoxicillin, 500 milligram capsule, 1 capsule by mouth every 8 hours for 7 days. Every question answered. A few reminders: use metric units throughout, state the route explicitly, never assume it's oral, write the frequency out in full, with timing where it matters, and always give a duration or a clear stopping point and a maximum dose for anything taken as needed. Complete beats clever every time. The SIG, the directions for the patient, deserves special attention because this is what the patient actually reads. On the do side, use plain, specific language, give the route, frequency, and timing, add the indication, like for blood pressure, which really helps adherence, and state the quantity per dose with a maximum for PRN medicines, and what to avoid, as directed with no detail. A vague PRN with no indication or limit. Abbreviations your patient simply can't read, and open-ended durations with no plan for review. Write the SIG as if you're speaking directly to the person taking the medicine, because you are. That covers the anatomy. Now let's move into the part that honestly is lives, safety, and error prevention. This is where those small, repeatable habits I mentioned earlier, stop real 10, and a missing leading 0 like 0.5 can be read as 5. And use immensity gauge instead of the micro symbol. When in doubt, spell it out. Let me slow right down on numbers, because this is where a tiny slip becomes a tenfold error. Rule 1. Always use a leading 0. Write 0.5 milligrams. Never just 0.5, which can be misread as 5. Rule 2. Never use a trailing 0. 5 milligrams, not 5.0, which can look like 50. Rule 3. Put a space between the number and the unit so they stay distinct, and spell out the risky units, and MCJ. Stick to metric throughout, and avoid the old apothecary measures, never just 0.5, which can be misread as 5. Rule 2. Never use a trailing 0, 5 milligrams, not 5.0, which can look like 50. Rule 3. Put a space between the number and the unit so they stay distinct, and spell out the risky units, and MCG. Stick to metric throughout, and avoid the old apothecary measures like grains and grams. These few habits eliminate a whole category of errors. Here's a quick mental checklist you can run in a few seconds before any prescription. The prescribing rights: right drug, right dose, right route, right time and frequency, right indication, and right documentation. 7 quick checks. And there's an 8th habit I want you to build in every single time. Confirm the patient's allergies and their current medicines before you add anything new. Run this list until it's reflexive. It's your last line of defense. Before you prescribe, 3 safety checks. First, allergies. Document not just the drug, but the actual reaction, and learn to distinguish a true allergy from an intolerance or a predictable side effect because that distinction changes your options. Second, interactions. Screen against current medicines, including over-the-counter products and herbals, and watch for high-risk pairs and duplicate therapy. And third, reconciliation. Compare what's prescribed against what the patient is actually taking, and do this at every transition of care, admission, transfer, and discharge. This is where errors love to hide. Some medications carry a heightened risk of serious harm, and they deserve extra respect. Insulin. Anticoagulants like warfarin and the dose. Opioids. Concentrated electrolytes such as potassium chloride. Chemotherapy and sedatives and infusions. With these, small errors cause serious harm, so build in extra safeguards. Use standard concentrations, insist on independent double checks, and make your dosing absolutely unambiguous. If a medication is on this list, slow down and double check. It's always worth the extra few seconds. Controlled substances come with extra legal requirements, and these vary from place to place. So let me give you the principles. Know your local schedule and the rules that apply to it. Include your registration or authority number where it's required. State the quantity in both figures and words to prevent tampering. Limit the quantity and refills in line with regulation. Never use press-signed or blank pads and store them securely. And document the indication, reviewing the ongoing need regularly. Above all, and I can't stress this enough, requirements differ by country and jurisdiction, so always follow your local law. One size does not fit all, so let's adapt for special populations. In pediatrics, dose by weight, milligrams per kilogram, check the maximums, and choose age-appropriate formulations. In older adults, start low and go slow, review polypharmacy, and keep an eye on renal function and falls risk. In renal or hepatic impairment, adjust the dose and the interval, and avoid drugs that are contraindicated. And in pregnancy and lactation, weigh the benefit against and choose the agents with the best safety data. The safe dose for one patient can be the wrong dose for another. If you prescribe antimicrobials, and most of us do, please prescribe them responsibly. Choose the right drug, dose and duration, matching the likely pathogen and treating no longer than needed. Where appropriate, take your samples or cultures before the first dose. Avoid antibiotics altogether for illnesses that are likely viral or self-limiting. Review at 48 to 72 hours. That's your moment to stop, switch to oral, or de-escalate as results come back. And document the indication along with the planned review or stop date. Good stewardship protects your patient today and everyone else tomorrow. Let me make all of this concrete with a few before and after examples. Amoxil 1 tab TID with vague which strength, what route, how long, comparator, amoxicillin 500 mg capsule, 1 capsule by mouth every 8 hours for 7 days, or Lasix 40 OD, which becomes furosemide 40 mg tablet, 1 tablet by mouth every morning, and insulin 10 USC, that U again becomes insulin, specify the type, 10 units subcutaneously before breakfast. These are illustrative. Of course, always dose to your patient and current guidance, But notice how the clear version simply leaves no room for guessing. Before you sign, take 10 seconds and run this final check. Correct patient, drug, strength and form. Dose wrote, frequency and duration all stated. Leading zeros used, no trailing zeros and safe units. No error-prone abbreviations. Allergies and interactions reviewed. Quantity and refills appropriate. Legible or e-prescribed, signed and dated. And the indication documented where it helps. That's it. 10 seconds now can prevent a great deal of harm later. Make this pause a habit you never skip. So let me leave you with the essentials. First, complete and unambiguous equals safe every element, every time. Second, most prescribing errors are predictable and preventable, which means they're within your control. Third, write for the patient and the pharmacist, not just for yourself. And fourth, when in doubt, verify the allergies, the interactions, and your local rules. Thank you so much for spending this time with me. If you found it useful, do share it with a colleague or a classmate. I'll see you in the next lecture. Until then, prescribe safely.